Okay, renal artery stenosis. Renal artery stenosis is a narrowing of the arteries that carry blood to one or both of the kidneys, most often seen in older people with atherosclerosis, which is a hardening of the arteries. So, renal artery stenosis can worsen over time and often lead to hypertension and kidney damage. The body senses less blood reaching the kidneys and misinterprets as the body having a low blood pressure. This signals the release of hormones from the kidneys that lead to an increase in blood pressure. Over time, renal artery stenosis can lead to kidney failure.
That's actually what happens when you have renal artery stenosis. So you get this elevated renin, and high amounts of renin result in higher amounts of aldosterone, which results in hypertension. So hypertension is really the big complication from renal artery stenosis, and it's often renal artery stenosis is by definition a cause of secondary hypertension, so it's not primary idiopathic hypertension, which is about 90 to 95% of patients who have hypertension have. It's secondary hypertension.
Okay, about 90% of the time, renal artery stenosis is caused by atherosclerosis, a process in which plaque made out of fats, cholesterol, and other materials builds up on the walls of the blood vessels, including those leading to the kidneys. More broadly, renal artery stenosis can be caused by a condition called fibromuscular dysplasia, in which the cells in the walls of the arteries undergo abnormal growth. More commonly seen in women and younger people, fibromuscular dysplasia is potentially curable. Here we have a case: a 37-year-old female, mother of two children, diagnosed to have pregnancy-induced hypertension. So, hypertension continued even after pregnancy and was really difficult to control. Is where all the drugs she was taking. Okay, those were usually the symptoms of renal artery stenosis. The pros is that initial treatment for renal artery stenosis is after medication, so you'd have to undergo surgery. The condition may require 3 or more different drugs to control high blood pressure, and patients may also be asked to take other medications, such as cholesterol-lowering drugs and aspirin. Cons is that in some cases an intervention such as angioplasty, often with staging of surgery, may be recommended. With angioplasty, a catheter is inserted into the body through a blood vessel and guided through the narrowed oblong renal artery. A balloon on the catheter is then inflated to open up the inside of the artery, and stent can be then placed to keep the artery. So the real con here is that you need to have surgery, and that is often uncomfortable. Here we have how they do a stent graft. So they go through the blood vessel until they reach the renal artery, which is this one. This one right here. So they go through the artery and then inflate the balloon so that the artery can uh, inflate and let the blood just go. Okay, the diseases accompanied or related to this. As I said before, you have to discuss these risks with your doctor. So the side effects could be blood pressure medication, including dizziness, sexual problems, headache, and cough. And the complications of angioplasty could include bruising, bleeding in the table, and additional kidney damage.